The first thing they did was laugh. Not loudly, not in a way anyone could point to later and say that was the moment. It was quieter than that. A glance exchanged between Treadwell and Korhonen across the nurse's station. A small, shared smile. The kind that doesn't need words, because the words would have been something like, "Look at this one." Sable Kerr had just walked in with her badge still swinging from where she'd clipped it crooked, her bag over one shoulder, her coffee thermos in the other hand. She was 31 years old, and she moved through the world the way she'd been trained to move through rooms she hadn't cleared yet. Scanning, quiet, nothing wasted. She didn't see the look at first. By the time she did, she'd already learned to file it away. St. Marguerite General was a mid-sized hospital in Ottawa. The kind that handled everything from kitchen accidents to cardiac events. The kind where every shift was different and everyone had opinions about everyone else. The emergency department ran on a particular social hierarchy that Kerr recognized within her first week. Not because she was especially perceptive, but because she'd spent years inside institutions that ran on exactly this kind of structure. The difference was that in those other places, the hierarchy was built on something real. Here, it seemed to be built mostly on seniority and the confidence that came with never having been seriously tested. Dr. Treadwell was the senior attending on Thursday evenings and most Friday mornings. He was competent in the way that well-trained people who've never been humbled tend to be competent. Precise, fast, and absolutely certain that precision and speed were all that mattered. Korhonen was the charge nurse. She'd been at St. Marguerite for 11 years, which she mentioned often, and in contexts where it wasn't entirely necessary. Together, they had an unspoken agreement about the department. It was theirs. It ran their way, and new staff were on probation until proven otherwise. Kerr hadn't done much to prove herself yet, at least not in ways they could see. She was quiet in briefings. She asked questions that were specific and sometimes unusual. She didn't laugh at the jokes that circulated during slow nights, not because she didn't have a sense of humor, but because she was almost always thinking about something else. She checked equipment at the start of every shift in a methodical, unhurried way that some of the older nurses found faintly strange. She kept her phone in her locker. She wore no jewelry. She had transferred in from a hospital in Winnipeg. That's what her file said. Before that, it listed several years of employment history that, if you looked at it quickly, seemed unremarkable. A string of positions, nothing flashy. Nobody looked at it closely. The comment that started everything came on a Tuesday night, about 6 weeks into her time at St. Marguerite. It had been a long shift. 2 car accidents, 1 pediatric fever that turned out to be something serious, a man in his 70s who'd had a fall and didn't want to admit how bad it was. Kerr had been working steadily all night, drawing bloods, managing IVs, monitoring a teenager who'd come in after a reaction to something she swore she hadn't taken. The girl's mother was beside herself. Kerr had sat with her for 4 minutes in the hallway outside the room. Not long, just long enough. Around 2 in the morning, the department went through one of those strange quiet patches that sometimes happen and that nobody trusts. Treadwell was at the desk, writing notes. Korhonen was at the station with a junior nurse named Farah, who'd been there 8 months and was still nervous enough to defer to everyone. Kerr came past them with a tray of supplies she was returning to the storeroom. Kerr. Korhonen's voice had a particular quality, not quite sharp, but with an edge designed to remind you where you stood. "You logged the Brennan chart yet?" 40 minutes ago, Kerr said without stopping. There was a pause. You should double-check your entries. First few months, things slip through. Kerr set the tray down on the counter. She turned. She looked at Korhonen for exactly long enough to make the silence deliberate. "I'll check it," she said. She picked up the tray and continued to the storeroom. Behind her, she heard Treadwell say, in a voice that was too quiet to be accidental, but not quiet enough to be actually private, "What's her background again?" "Because she's got the personality of someone who's never had to work with other people." Korhonen made a sound that functioned as a laugh. "Winnipeg," she said. Before that, apparently some kind of government health position. I looked at the file. Very vague. "You know what vague means," Treadwell said. "It means nothing impressive," Korhonen agreed. Farah didn't say anything. She was looking at the floor. In the storeroom, Kerr set the tray on the shelf. She pressed both hands flat against the metal edge of the shelving unit for a moment. She breathed in through her nose and out through her mouth. It was a technique she'd learned a long time ago, in circumstances that had nothing to do with hospital politics. And it was effective for exactly the same reason. It reminded you that whatever was happening in your immediate environment, you were still here, still functional, still capable of doing the next thing. She turned off the storeroom light and went back to finish her shift. The thing about Kerr, the thing that Treadwell couldn't see and Korhonen didn't bother to look for, was that she had spent 4 years as a Royal Canadian Navy medical assistant attached to a Joint Task Force 2 forward support unit. She hadn't planned on it. She'd started as a regular naval medical technician, done her training in Esquimalt, been posted to a frigate for 2 years. She was good at her job in the way that came from genuine attention rather than ambition. She noticed things. She remembered details. She never assumed a situation was stable just because it looked stable. Somewhere along the line, the right people had noticed her noticing things. The secondment to JTF-2 support wasn't something she talked about. Partly because she'd signed things that made talking about it inadvisable. Partly because in her experience, the people most eager to hear those stories were also the people least capable of understanding what they actually meant. What they meant was not heroism, not adventure. They meant months of functioning at a level of focus that left very little room for anything else. They meant learning to make medical decisions in conditions where the variables were all wrong and the margin for error was 0. They meant holding a tourniquet at 3 in the morning in the dark, having a conversation with yourself about what you were going to do next, because nobody else was available to have that conversation with you. She'd come out of it intact. Mostly, she'd taken a leave, done some work with Veterans Affairs that was quieter and less satisfying. Eventually decided that what she actually wanted to do was nursing. Real nursing, in a real hospital, in a city where people needed help, and she could provide it without any of the parts she didn't want anymore. She'd moved to Ottawa. She'd taken the job at St. Marguerite. She hadn't said anything about any of it because it wasn't relevant. Or so she thought. It was a Wednesday in March, around 4:15 in the afternoon, when everything changed. Kerr was 20 minutes into her shift when the radio traffic started. She heard it the way she always heard things that mattered. Not louder than everything else, but somehow clearer. 2 vehicles. A training exercise gone wrong at the Canadian Forces Station Dwyer Hill facility, 40 minutes southwest of the city. Multiple casualties incoming, at least 1 critical. She was already at the supply cart when Korhonen came around the corner, reading something off her tablet. "Trauma call," Korhonen said, mostly to the room. "Military, multiple incoming." Treadwell's in with a patient. He'll be out in 5. Everyone get ready. What do we know? Kerr asked. Korhonen glanced at her. We'll know when they arrive, Kerr. The first 2 arrived within 12 minutes. One had a fractured arm and a head laceration, serious but stable. The other had taken shrapnel to the torso during what the accompanying medic described as a breech exercise malfunction. The medic was young, clearly rattled, doing his best to stay clinical. He handed over a field report that Kerr scanned in about 4 seconds. Treadwell arrived at the same moment, took the report from Kerr's hand without looking at her, read it in what she estimated was considerably less time than the situations required. Get him to trauma 2, he said. I want a full panel and imaging. He's hypotensive, Kerr said. I can see that. His pressures dropped 8 points since the field report was written. The trajectory suggests. I know what the trajectory suggests, Kerr. Treadwell's voice had the particular flatness of someone who was managing the situation and also managing her. Let's get him moved. The patient's name was Warrant Officer Anand. He was 36 years old, broad through the shoulders, the kind of person who looked like nothing should be able to stop him. And right now his skin had the gray-white quality that Kerr recognized, and that meant something specific. His eyes were tracking. He was conscious. He was trying not to show how scared he was. I've got you, she said, low, close to his ear, as they moved the gurney. Not theatrical, just true. His eyes found her face and something in them settled slightly. In Trauma 2, the team moved fast. Treadwell ordered the panel. He ordered imaging. He was managing the visible injuries. The shrapnel wounds had been partially debrided in the field, and the damage was significant, but Treadwell had seen worse. He was focused on what he could see. Kerr was watching what she couldn't. She was watching Anand's color. She was watching the way his breathing had developed a very slight hitch on the left side that hadn't been in the field report. And that could mean several things, none of which were good. She was watching his hands, where the fingers were showing a peripheral perfusion response that she'd seen before in environments where delayed internal bleeding was the problem nobody had caught yet. Dr. Treadwell. She kept her voice even. I want to flag a possible haemothorax. Treadwell looked up from the wound he was assessing. Imaging will show it. Imaging takes time we may not have. His breath sounds on the left are diminished. His JVP is Kerr. A clear stop signal. I hear you. Imaging will show it. Let me work. She stood at the edge of the controlled chaos of the trauma bay, and she ran the numbers in her head the way she'd done hundreds of times in conditions that didn't include overhead lighting and a full team. She thought about what she was seeing. She thought about what she'd been told about timelines and about what she knew about timelines from experience and about how those two things didn't match. Anand coughed. It was small, suppressed, but it wasn't nothing. She moved to the portable ultrasound before she made a conscious decision to do so. It was a POCUS unit, point of care ultrasound, that lived in the corner of the trauma bay and was available to the nursing staff for specific approved uses. She positioned it. What she saw confirmed what she'd suspected. She looked up. Treadwell was on the other side of the bay, talking to Korhonen. She did the calculation, not the emotional calculation. That was already done, had been done the moment she saw the ultrasound image. The professional calculation, the one that accounted for protocol, for hierarchy, for what she was technically authorized to do versus what she was trained to do versus what needed to happen in approximately the next several minutes. Dr. Treadwell, she said. Her voice was different now. It wasn't louder exactly, but it had a quality to it that cut through the room the same way a certain kind of command voice always did, when you'd learn to use it in places where not being heard was not an option. He has a left haemothorax. I'm looking at it right now. He needs a chest drain. The room went quiet in the particular way that rooms go quiet when something has shifted. Treadwell crossed to her. He looked at the image. For 2 seconds he didn't move. Then he said, "Get me a thoracostomy kit," and the room moved again, faster. He did the procedure. He was skilled and he was fast, and it was the right call. And Anand's pressure stabilized and his color began to come back in the way that color came back when the problem was being solved. Korhonen was there, and Farah was there, and 2 other nurses and an RT, and in the middle of all of it, Kerr was simply working, doing what came next, handing what was needed, watching the patient's face. Anand reached out and put his hand on her wrist for a moment. He didn't say anything. She didn't either. After, in the hallway, Treadwell caught up with her. "That was outside your scope," he said. It wasn't a question. "The POCUS use was within approved nursing parameters," she said. "I'm talking about how you addressed me in there." She looked at him. "I was telling you what I was seeing, the way you told me." "Warrant Officer Anand is stable," she said. "I'm glad he's stable." The next morning, there was a meeting. Korhonen had filed a report. "Not a formal complaint," she said, "just a note in the record. A concern about professional boundaries, about a staff member who had difficulty recognizing the limitations of her role." Kerr sat in the meeting with the department head, Dr. Vachon, and she answered the questions she was asked, and she did not say most of what she was thinking. She did not say that she had performed needle decompression under fire in a context that bore no resemblance to anything a hospital committee had procedures for. She did not say that she had run triage on 4 casualties simultaneously with equipment that would have embarrassed the average high school first aid kit. She said that she understood the concern, that she respected the chain of command, that she was committed to working within the protocols of the department. She said it because it was true. It was also true that Anand was alive. Vachon listened. Vachon was careful. Vachon said she would note the conversation and that Kerr should continue to demonstrate her commitment to the team. Kerr went back to work. 3 days later, she was in the middle of a medication round on the non-acute floor when one of the ward clerks found her. "There were people at the front desk," he said. He seemed slightly uncertain about how to describe them. "Military," he said. "Several of them." She finished what she was doing. She capped the syringe she was holding, noted the time, told the patient she'd be back in 20 minutes. Then she walked to the front of the hospital. There were 6 of them. They were in combat dress, which was unusual for a hospital visit, which meant this was intentional. 3 were people she didn't know. 2 she recognized. 2 she recognized. The one at the front she knew better than almost anyone she'd known in the previous decade. Chief Petty Officer Kavanagh had been her senior NCO for 2 of her 4 years with the JTF-2 support unit. He was in his mid-40s, gray at the temples, with the kind of face that had been exposed to enough weather and difficulty to have settled into something permanent and calm. He looked at her now the way he'd always looked at her, with the particular version of respect that is entirely without sentimentality. "Kerr," he said. "Chief." He turned slightly to face the direction of the trauma bay and the ER, and the other 5 turned with him as a unit, without any visible signal being given. It was the kind of movement that people who've spent years operating together make without thinking about it. "We heard what happened with Anand," Kavanagh said. "He's improving. He should be out of hospital within the week. We know. We came because there's something that needed to be done in person. She started to say that wasn't necessary. He stopped her with a look she recognized. Warrant Officer Anand asked us to pass something along, he said. He said, and this is a direct quote, because he made me write it down, that there was a nurse who talked to him like he was still a person. When he was scared, he was going to be a statistic. He said he wants the hospital to know what they have. I was doing my job, Kerr said. That's why we're here, Kavanagh said simply. He came to attention. All 6 of them did. It was precise and unhurried and completely serious. And in the lobby of St. Marguerite General, on a Thursday morning, they held it. Kerr didn't look away. She didn't make a performance of the moment. She stood straight and she let it happen. Because it wasn't about her ego, and it wasn't about proving anything. It was about the men she'd worked alongside for 4 years in conditions that had cost all of them something, and about the warrant officer in a hospital bed down the hall who had been a person in the worst moment of his life and had needed someone to treat him accordingly. Korhonen was at the nursing station. Treadwell had come around the corner from somewhere and stopped. Farah and 2 other staff were visible through the doorway. The ward clerk was standing very still near the wall. Nobody spoke. After a long moment, Kavanagh said quietly, Petty Officer First Class Kerr, former Naval Medical Technician, JTF-2 Forward Support, and one of the most capable people I have ever had the privilege of working alongside. Whatever she told you, you should listen to it. He looked at Kerr one more time. Take care of yourself, he said, and keep looking after our people. Sir, she said, they left the same way they'd arrived, without ceremony, without waiting for a response. The lobby was quiet for a moment that lasted longer than a moment. Then Dr. Vachon, who had appeared at some point during all of this, and whose expression Kerr hadn't noticed until now, turned to Treadwell and said, in a voice that was entirely even, I think we should schedule another conversation about that departmental note. Treadwell didn't answer immediately. When he did, it was to Kerr, and whatever he'd intended to say seemed to change somewhere between intention and words. The haemothorax call was right, he said, for the record. It cost him something to say it. She could see that. She didn't take pleasure in it. Thank you, she said. Anand was discharged on a Friday afternoon, 9 days after he came in. His wife had been there most of that time. A woman named Devika, who had the kind of exhausted, watchful quality of someone who had been afraid, and was now slowly, carefully allowing herself to stop being afraid. Kerr had passed them in the hallway a few times and hadn't made anything of it. On his way out, Anand stopped at the nurse's station where Kerr was working. He stood in civilian clothes, looking unfamiliar in the way that patients always look unfamiliar when they're upright and dressed, and no longer in the context where you knew them. He had a good few inches on her. He looked at her for a moment without saying anything. I remember your voice, he said. In the bay. I was trying to stay with it, she nodded. I know. My wife wants to thank you. I told her there's really no good way to do that. She doesn't need to. He nodded, accepting this. You know what I remember thinking? When I heard you in there with Treadwell, he paused. I thought, she sounds like someone who's done this before. Not here, somewhere it actually mattered. She held his gaze. Every time matters, she said. He looked at her for a moment longer. Then he nodded once, the same kind of nod you gave when words were technically available, but not actually necessary. Devika touched Kerr's arm as she passed. Didn't say anything. Didn't need to. Kerr watched them walk to the elevator. The doors opened. They got in. The doors closed. She turned back to the chart she'd been working on and finished her notes. The departmental note was withdrawn. There was no announcement about it, no correction issued to staff. It simply wasn't there anymore. The way certain things at certain institutions quietly stop being there when the situation has clarified itself sufficiently. Treadwell didn't change overnight. That wasn't how people worked. And Kerr had been in enough situations to have lost any illusions about transformation being fast or complete. But he started to consult her differently. Not deferring, not performing contrition, just using what she knew the way you used anyone who knew something useful. That was enough. More than enough. Korhonen was harder. She remained careful around Kerr in a way that was itself a kind of acknowledgement. The comments stopped, the small corrections stopped. What replaced them was a watchful neutrality that Kerr found, in its way, perfectly workable. She wasn't looking for friendship. She was looking for patients who got what they needed. Farah started asking her questions. Real questions. Clinical questions. The kind you asked when you were trying to understand something rather than when you wanted to seem like you understood it. Kerr answered them. When she didn't know something, she said so. They started having conversations after the shift handover that lasted longer than was strictly necessary, leaning on the counter near the medication room, talking through scenarios that were unlikely but worth knowing. It was on one of those evenings that Farah asked carefully, not prying, just asking, whether Kerr had worked in emergency before St. Marguerite. Yes, Kerr said. Military, a pause. Not a hesitation exactly. More like the moment of deciding how much was useful. For a while, she said. Farah nodded. I figured. You look at patients differently. How so? Farah thought about it. Like you're not surprised by anything, but you're still paying attention. Kerr considered this. That's about right, she said. She finished her coffee and went to get her coat. Outside, the Ottawa evening was cold and clear, the kind of cold that had weight to it, that reminded you that you were in a specific place, in a specific season, and that both of those things were real. She walked to her car without hurrying. She thought about Anand, about Devika's hand on her arm. She thought about Kavanagh standing in that lobby, with 5 people who didn't need to be there and had come anyway. She didn't think of herself as a hero. That word had always struck her as belonging to a story someone else was telling, one that needed its edges rounded and its complications removed to fit a shape people wanted to see. What she knew, what she'd always known, was simpler than that and less comfortable. That there were moments when someone had to know what to do, and that the only thing worth carrying from all those years in difficult places was the ability to be the person who knew. She'd known what to do. She'd done it. Whatever anyone made of that was their own concern. She had another shift in the morning, and there was a protocol update she wanted to review before she slept. And the cold was settling into her fingers, and it was time to go home.